Hello everyone, my name is Eloy Hernandez, and in this presentation I will be talking about meningitis. What is meningitis? The prefix of meningitis, menix, means membrane, and the suffix of meningitis, itis, means inflammation. So when put together, it means membrane inflammation. The definition of meningitis is a life-threatening disease that causes inflammation of the membranes that surround the brain and the spinal cord. These are called your meninges. Your meninges consist of three membranes that defend the brain and the spinal cord and always provide structural support. On the outside layer, you have the thickest and the strongest layer, which is your dura mater. In the middle, you have the arachnoid matter, which gets its name from its web-like appearance. And the last layer, which is the thinnest, the deepest, and the most sensitive, the pia mater. Between the layers, there are spaces that are called cavities. The cavities may contain blood vessels and spinal fluid, which also is known as CSF. What causes meningitis? The infection can be caused by bacteria, viruses, fungi, and parasites. Once the infection is in the body, they invade the subarachnoid space, the cavity between the middle and the last layer, where then the immune system will respond by releasing the immune cells, which then release inflammatory molecules, which then also causes more immune cells to arrive. The inflammation occurs due to the expansion of the blood vessels in the cavity. Depending on the cause of infection, the severity and the symptoms will vary. Viral meningitis is the most common type of meningitis. It is caused by viruses such as herpes, mumps, influenza, and other types of viruses. The symptoms are mild, but they include fevers, headaches, stiff neck, photophobia, which is sensitivity to light, nausea, and confusion. There's no specific treatment. However, if things get severe or if you experience any type of meningitis symptoms, please seek medical help. However, most people get better on their own after 7 to 10 days. Another type of meningitis is bacterial meningitis. It's caused by bacteria such as E. coli, Group B, Streptococcus, and other types of bacteria. This type of meningitis is very life-threatening and very severe and can cause death within hours. It requires medical treatment, and if someone does recover from bacterial meningitis, they will have permanent disability. Some symptoms include high fever, severe headaches, skin rash, confusion, neck stiffness, and seizures. If the bacteria enters via the bloodstream, some other symptoms include cold feet, cold hands, joint pain, muscle pain, rapid breathing, diarrhea, and or purple or red rashes on the skin. Another type of meningitis is fungal meningitis. Fungal meningitis is a fungal infection around the brain and spine. It's caused by fungi and is very rare and hard to diagnose. It can be caused by contamination during medical procedures or breathing in fungal spores. It affects those with weak immune systems mainly, and symptoms include fever, headaches, confusion, stiff neck, and photophobia. The symptoms develop very slowly. A last type of meningitis is parasitic meningitis. It is caused by parasites entering the body. It's less common and can be caused by contaminated water, contaminated food, insect bites, and has no specific treatment and is hard to diagnose. It can cause it can be very dangerous and if not diagnosed or treated properly. It can also lead to death. Some symptoms include headache, stiff neck, photophobia, nausea, fever, confusion, tingling or painful feeling on the skin, weakness, and loss of body control. Meningitis can affect all ages, all genders, all races, but it mainly affects younger children and they are most at risk. Symptoms include in newborns include feeding poorly, slowness, inactiveness, abnormal reflexes, irritability, vomit, and mainly a baby bump on their head. Meningitis can be transferred depending on the organism. It could be viral, bacterial, fungi, or parasite. It can be the result of your environment or where you've traveled recently. It can also be transmitted through sneezing, coughing, via the bloodstream, medical procedures, drug drug allergies, chemical reactions, different types of cancers, and even touching contaminated surfaces and objects. To prevent meningitis, if you're already living with someone with viral bacterial meningitis, you should avoid close contact, wash your hands frequently, practice good hygiene, avoid sharing items like toothbrushes, cups, food, forks, or drinks, etc., and talk to your doctor about getting prescribed some antibiotics. A good way to prevent meningitis is to get vaccinated. Some vaccines that help prevent meningitis is MenACWY, which is given between ages 13 to 15, MenB, which is given between ages 8 to 16 weeks, which is also followed by a booster shot at 1 year old, and MenC, which is given between ages 12 to 13 months, which is also followed by a booster shot. The process of diagnosis is first begun with a clinical examination. They then will collect the samples, some blood samples or cerebral spinal fluid samples, which is also known as a lumbar puncture. With the samples, labs can be run to figure out the specific type of infection and the specific cause. CT scans or MRIs will also be taken just to check for any complications. It's very important to have a proper diagnosis so the right treatment can be given. If meningitis is found, the treatment depends on the type of meningitis and the severity. If bacterial meningitis is found, the person should go to the hospital right away and get medical treatment, which requires antibiotics and corticosteroids. If it's viral meningitis, antibiotics won't help, but they will get better within a few weeks. Bed rest, lots of fluid, and pain medicine are suggested. If it's fungal meningitis, a antifungal medication is required. If meningitis is caused by allergy or an autoimmune disease, it is treated with corticosteroids. Cancer-related meningitis is treated with therapy related to the specific cancer. However, if you're having symptoms related to meningitis, please seek medical help right away, because if it is not treated, the results are fatal. If it is not treated correctly or quick enough, death will occur within hours. 1 in 6 people who get bacterial meningitis pass away. In 2013, the fatality rate was 14.3% in the United States. 1 in 5 get severe complications. And if a person does survive, the disabilities are permanent. Some permanent disabilities are deafness, learning impairment, behavioral problems, social problems, and comas. The sub-Sahara In sub-Saharan Africa, also known as the meningitis belt because they have the greatest number of cases, the outbreaks of bacterial meningitis are more common and have higher cases during the dry seasons. They get about 1,000 cases per population size of 100,000. Compared to Australia, Europe, South America, and the US, they range from 0.10 to 0.25 cases per 100,000 population per year. The highest rate comes from children between 5 to 14 years old. In summary, meningitis is a very, very serious condition and causes inflammation in the meninges that surround the brain and the spinal cord. It's caused by viruses, bacteria, fungi, and parasites, and can be very fatal and lead to death if not treated properly or quick enough. Please go get vaccinated. But if you experience any of the following symptoms, fever, headaches, confusion, nausea, stiff neck, or photophobia, please get checked for meningitis. This is my work site.